Hi everybody, it's Dr. Sandy Kramers. We recently got a great question from a patient that we often get as to which is the best way to start if you're about to start treatment for dry eye disease. Should you start with Meibomian gland probing or intense pulse light? And so I want to go through that in the future podcast we're going to do at the eye show. But just to give a little bit of information for this patient that emailed us, the answer really depends on some factors. Number one is your symptom score. We have many patients that have told us that they felt worse after a Meibomian gland probing or an IPL or even a LipiFlow. Sometimes when you do anything to your eye, even putting on certain types of mascara and so forth, there can be a feeling of discomfort. Maybe you've stimulated some inflammatory cells. So we really are trying not to cause more discomfort to patients. So that'll be a factor in some of the decisions we'll make. Number two is, what does your meibography look like? As you may have heard in previous podcasts, we have certain patients that have come in for years with no symptoms, but very few glands, and trying to convince them to spend a lot of money out of pocket for something they have no symptoms has been very difficult. Some of these patients have come back year and year again, and finally, after 5 or 10 years, they started noticing their dry eyes. And even though I would try to kind of encourage them to take care of it, or at least do something to keep the oil pumping, decrease your screen time, blink, it was very hard to convince them to obviously follow Dr. Maskin's recommendations of probing, which I agree with a lot of what he says, but I do know that it really depends on your meibography as to what we probably should do first. The third thing is if you've been on Accutane before. If you've been on Accutane, the majority of patients are going to need probing, so we will offer it first. The issue that we're running into is that, of course, none of these are covered by insurance. They're very expensive, and probing is more uncomfortable for sure than the intense pulse light. We have many papers, both by Dr. Toyos, who has a vested interest in IPL, and Dr. Maskin, who has a vested interest in probing, that say their technique works. And there's really only one good paper, which we'll talk about in the podcast, that compares them together, doing the probing first, then the IPL, that was done in Korea. It was only a small number of patients, I think it was 36. The groups were separated into one group doing IPL, one group doing probing, and the third group doing both together. And the third group doing both together had the best results. And we have been doing that in our practice for years, even before the paper came out, because it just made sense. The intense pulse light is an anti-inflammatory device. It's true. It does liquefy the oil. It's true. But it does not open up blocked perifibril fibrotic scar tissue of the orifice. And that is also needed in many patients, not everybody. And that's where there's controversy. And we won't know the answer to this question for years to come when there's better randomized controlled prospective double-blinded studies, but it really depends on the patient. Most patients do well just with IPL alone. But if we find that there's nothing coming out, or we see that meibography shows very little oil left, we will do probing first. And so it's something to consider depending on your symptoms, what your meibography shows, and if you've had Accutane or other medications like spironolactone that we know is doing something to the oil gland to make it not function as it should. And then I do believe that most patients do have periductal fibrosis, but I think that by milking the oil and the anti-inflammatory effect of IPL, a lot of my patients do very well and do not need probing. But they do all those other things that we talk about, blinking, closing the eyes. Some people can do warm compresses. Some people are made worse by warm compresses. So there's a lot of different factors that we try to kind of talk about with the patient when they come to visit us to see what's the best first step. With my eyes, I had IPL first. I've got immediate improvement. I was actually shocked because, of course, I've done this on patients, but unless it's yourself, sometimes you don't believe it until you see it seriously. So I was shocked that it actually really improved some real discomfort I was having in an upper eyelid after one session. And we did the video of the expression, and it was clearly kind of thick. So for me, IPL alone was enough. But if I get older, which I hopefully will, and the symptoms start coming back and IPL is not helping, or the oil is not coming out like olive oil, then I will have probing done on myself because I do know it does work. So the answer to the question that many patients do ask, and I know our patient is asking as well, it really depends on those factors. So when I see you, we will talk about that and see what the next option is or the best option is. But for most of my patients, we give them at least one chance with the IPL because it's less expensive, it's less uncomfortable, and the issue is that it's still working as an anti-inflammatory. And the way we do it is intense pulse, light, then expression always. Expression, IPL without expression probably does some type of anti-inflammatory effect, but I don't think it's as effective without expression. So I hope this answered your question, but we will talk about this on the next podcast episode of The Eye Show. Thank you. Have a good day.